about it early.
Okay.
Varicoceles are something that you can do something about early.
So what's the exact best way to fix it, a varicocele?
So a varicocele is basically, it's the most common potentially reversible cause of male infertility. So
Okay.
15% of all men do have varicoceles, and 40% of men who have subfertility have varicoceles. So, and basically what it is dilated veins in the scrotum. So the way people think about it is, you've seen people with varicose veins in their legs, at the knee.
Yeah.
Often women who've had children, it's basically, the problem is that the valves that are bringing the blood back up to the blood back up to the heart are not working. So the blood collects in the lowest area. That's a varicocele. And when it's happening in the scrotum, and we know that it has a negative effect on the testis and on sperm production. The theory is by warming up the testis. So that's what I was
Yeah.
saying, that the pediatricians will sometimes pick up in adolescence. So if we fix it, then 2/3 of the men will have an improvement in their sperm quality, but
Okay.
1/3 of them won't. So it doesn't always help.
And so what's the best way to fix it?
So there is a gold standard way to fix it, which is called, it's a mouthful, of microscopic, which means we're looking under the microscope, subinguinal, which means you go right below where the inguinal canal is, where you have a hernia. So right basically where the pubic hair is, 1 inch above and 1 inch over. You make a small incision, you pull up on the blood vessels, and then you're actually looking through an operating microscope and tying off the veins. And what that does is it stops the blood from going backwards. And then people ask, well, where does the blood go? It finds other routes. Just like with people with varicose veins in their legs, they strip
Mhm.
out the superficial ones and the deep ones take over.
How successful is the treatment?
Well, the surgery itself is very good at getting rid of the
Mhm.
varicocele. And 2/3 of the time, you'll see an improvement in the sperm production. But just remember that the sperm that a man is ejaculating now the sperm started dividing 2 or 3 months ago, really 3 months ago. So you won't see any improvement when you do anything until 4 or 6 months. So it doesn't stop things, it doesn't put you on hold, you just won't
Right.
see those improvements.
And what is the procedure actually? Is this a sleeping one? Is this
Yeah, so it's done as a local in the hospital, because you need the microscope and the anesthesiologist, but local with sedation. So the way I do it, 98% of the men are sleeping but not intubated. So it's sort of nice. And it's done as an outpatient. I do them on Fridays, and when people, were going to work, before COVID, then we would find that most of them were going to work by Monday.
and what's the pain level like afterwards?
It's really not, I mean, everyone has different pain thresholds. So you
Mhm.
have, like, I'm terrible at pain, so it's always worse than they tell me it's going to be. But,
Mhm.
it's much less than a hernia. They're not moaning around that weekend. Sometimes I call them afterwards and they're on the golf course and I'm yelling at them, get off the golf course, because I don't want them to
Yeah.
cause bleeding or anything like that. But
Yeah.
it's not terrible. It's really, actually, it's much less than your typical surgery.